Hello, I'm Dr. Jamie Longobardi, and I'd like to talk about what makes a successful public health collaborative service team and their relationship to my service learning experience working at Discovery Club, a 12-step club in Springfield, Illinois. Discovery Club is a meeting house for 12-step programs in Springfield. I have been attending 12-step meetings at Discovery Club since I was 14 years old, when my mother took me to Alateen. This is a 12-step program for children of alcoholics. As I have grown, I have continued to participate in several 12-step programs on and off throughout the years, including Alcoholics Anonymous. The success of AA is established by the anecdotal fact that no matter where I have been in the world, I have always been able to find an AA meeting. Now, because I haven't been active in 12-step programs for a few years, I participated in work at Discovery Club in basic maintenance of the facilities and attended meetings. Without facilities like this, the groups that meet there would be unable to meet and would have to rely on churches and other facilities. Every public health collaborative service team needs a few items for success. Let's review some of these items. First, they require tools to support integration. These tools must be practical and easily utilized by the team. AA uses the 12 steps, which are these practical tools. The 12 steps are a guide which assists members of the group in the improvement of their interpersonal relationships and mental health. The 12 steps loop back and encourage members to give back to the organization through service to fellow members. The 12 steps are easily taught, and implementation in one's life takes minimal resources. For this step, as I was helping with maintenance and setup and breakdown before and after meetings, this is part of the service to my fellow members. Next, a public health collaborative service team needs some type of education program. This way, the current leaders can pass on their experience and knowledge to the next generation. In the case of 12-step communities, the action of sponsorship is similar to that of apprenticeship or mentorship. Older, more experienced members of the group teach new members how to apply the program to their lives. Once the new members, or sponsees, have sufficient understanding of the program and are sufficiently stable, the sponsors assist their underlings in taking on new members themselves. Often in a well-established 12-step group, there are chains of 3 to 5 sponsor-sponsee relationships within the group, all working together to ensure the program stays true to the vision of the founder of Bill Wilson. I have acted as a sponsor in the past, but for this event or experience, I did not, because I had not been a member of the group for some time. This leads to the next essential requirement: training the current workforce in regards to not only the need to work together, but also how this is best accomplished, all with a common goal of population health. Again, the sponsor relationship and decades of community experience directs this need. Each member of a 12-step community is introduced to the group with one underlying piece of understanding: that alone an addict is weak, but together they are strong and can overcome addiction together. It is the most important aspect of any 12-step program. The final aspect of a successful public health collaborative service team is strategic coordination among partners. 12-step groups are their own strategic partners. While each program and its membership is anonymous, and each group operates independently, clubs like Discovery Club exist across the world, and along with churches and other meeting spaces, and now online meetings, ensure that anyone who needs a meeting or wants a meeting has a place to go. There are regional events which bring hundreds and in some cases thousands of members to ensure that a web of interconnection exists. AA and other 12-step programs are one of the most successful public health programs that have ever existed. It is inexpensive and well established. Sponsors both assist new members and train the next generation. Groups are interconnected, but also autonomous, and all utilize the same 12 steps. Thank you for your attention. Resources are listed in the description.